Hi, 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 everyone. How are you? Happy Wednesday. We've made it halfway through the week, and I want to thank you for joining me. I'm Dr. Christy Perez, and this is Ask Dr. Christy. We are doing a program with AIDS United powered by the Melanated movement, an opportunity for you to ask all the questions in a safe space, be reassured, but also get tapped into some great information. And we're going to let you know a lot of wonderful things. So, what I want to go ahead and start off with is I want to go ahead and give you a little breakdown of some really great and interesting things that have been happening all around news and politics with some of the issues related to AIDS and HIV here in the United States. And so I want to first go ahead and I want to shout out that yesterday was National Women and Girls HIV Awareness Day. This is a pivotal time where we have to be aware and be paying attention to the advancement of healthcare, particularly around women. While HIV and AIDS is an issue that affects everybody, we know that historically the political and the medical field hasn't done the greatest job at centering the health and wellness of more marginalized communities, but specifically women and women of color. So yesterday there was some really great stuff that happened. There is this beautiful story I want to go ahead and share with you that I found. And what we saw a lot of activists and advocates come together for the intersection of HIV and AIDS care along with other health issues. And I found this really wonderful article on Pause that I want to share with you. And later on, after the stream, you'll be able to go onto my story and find some of these articles linked as well. But what I thought was incredible was to see women stepping forward, getting active as we are paying attention to what is happening in the funding landscape. And we're seeing that services, care, and even ultimately organizations are just being affected in a way that is not beneficial to our people. So that is the first piece of news that I wanted to go ahead and share with you. I also wanted to go ahead and share with you some not great news. So as some of you may know, at the beginning of March, Florida was at this point the first state to take renewed efforts to begin to basically regulate how, who, and when can access antiviral medication. And, this is a concern for us because what we're seeing is we're seeing a time, particularly if you're here in Georgia, where we are having the highest rate of need in terms of service. And so there are actually states taking measures right now to limit HIV drug assistance programs. At last count, it's over 18 states that are affecting the landscape of safety and wellness for many, many communities. And what I would like to recommend, because I know this is a heavy news, a lot of times we get heavy news and it's like, what do I do with this? Well, talk to the people that decide what the purse does. You see, a lot of these programs receive federal and state dollars. Talk to your legislators, talk to lawyers, and also never forget, lawyers can help you bring cases. It might be a big headache, it might be a pain, it might be a stress, but you may be responsible that in the course of fighting for your own access and your own healthcare, you may also do a great service to many, many people. It's really important that we use our voices and that we use our resources, that we show up in coalitions, that we organize together. So I want you to take this type of heavier news a little bit with a grain of salt, because ultimately, progress has been winning, humanity has been winning, and we will continue to win. Some other stuff that I would like to share with you from the news. Again, some of these things are not that great in terms of positivity, but I think it's important for us to know what is happening and why it's important. So quite recently, there was about 13 activists that were arrested and taken into custody for demonstrating and organizing around HIV advocacy, HIV issues, advocating for funding, and essentially trying to protect health, wellness, and human dignity. And I think this is a really important thing for us to pay attention to. Anytime people are penalized for wanting to ensure that lives are saved, I think this sends a pretty strong signal about how serious things have gotten, the kind of dark tone that has been set. And it's really a reminder that a lot of us sit and wait for someone else to solve the problem. We are so used to lawyers and human rights groups and activists and organizers, and it's wonderful. And we appreciate having them because we have regular jobs and regular days and children and responsibilities and stuff. But in moments like this, when we see our goodwill representatives, our voices, our activists being penalized, it really does call into question, when is a good time for us to begin to try to get a little bit more active in the process? And our last really great piece of news is going to be that at USC, professors have now begun a therapy research in quest for an HIV cure. What makes this different is that it is a genetic component. Now, there has been a lot of discussions around genetic components in gene therapy in HIV, and we're seeing a lot of great breakthroughs and developments in different areas, such as with CRISPR technology that happened over the past year. But this is a very interesting approach, and I actually have spoken to a friend of mine who works at Emory University, and the prediction is roughly that we might be as close as 5 to 10 years away. And I know for a lot of people, especially dandelions, people of that have lived, their entire life with the diagnosis. The reality though is we seem like we're always being told, oh, it's just around the corner. It's just around the corner. But it is right around the corner. And so that is really great. It's really great to see that academia still is, researching, that medical science is still questing, and that they're examining new paths forward, that they're taking, every possible option to go ahead and make sure that we can save tons of people and just make this a thing that is irrelevant. So I thought that was really cool. Her name is Dr. Paula Cannon, by the way. So that's great. Anyway, I want to go ahead and just plug a reminder before we switch to our segment where I answer your questions, that we are here the second Wednesday of every month. It's going to be a fabulous time. And again, you can go ahead and submit questions by going directly to AIDS United's or the Melanated Movement's Instagram pages. You can also go on their website at aidsunited.org. If you want to shoot a more confidential question, or you want to have a conversation, you can, of course, feel free to reach out to me at cperez@aidsunited.org. Again, that's C Perez at aidsunited.org. And I would love to go ahead and have those conversations with you. I think it's really important for us to have access to individuals that are able to give us informed information that is well informed. That was a tongue twister for me for some reason, but also just to have empathetic environments. A lot of people have questions, and we want to be there to support you. We definitely want to make sure that you have access to that. So what I want to do now is I want to pivot into some of these remarkable questions that our team got this week. It has really been fabulous. We've gotten a lot of great questions, and I'm excited for us to go ahead and jump into them. So we can go ahead and start with our first one. Our first question is, I want to be supportive to a friend living with HIV, but I'm afraid of saying the wrong thing. What actually helps people feel supported? This is a great question, and it says a lot about who you are as a person. And I'm really, really glad that you exist. So I think that who you are, the type of safety and relationship that you've built with your friends, it's important for our loved ones, our friends, to know that we never mean any harm. And, support often is best done by creating the space, creating that safety, being somebody who this person knows based off of every other piece of, context and experience with you, that you are a warm, safe place. And I think that what actually really helps people feel supported is just knowing that somebody is staunchly in our life, so it can be things like, asking how you're doing. Now, of course, you have to be careful with that, because it can cross over from, hey, how are you doing, to like, oh my God, they're asking me all the time how am I doing. I think just treating them as a regular person is a great way to do it. There is a lot of misunderstanding around people who are living with HIV. And the reality is that they enjoy a wonderful quality of life. Medical science has provided answers in terms of addressing fatigue and, immunosuppression and things like that. And so the quality and length of life that is enjoyable is robust. And I think that, you want to just be a good friend in general, whether your friend has HIV or doesn't have HIV, is living with HIV, is not living with HIV, just be a good friend. And that way, if there is something that comes up at some point where they want to vent or they need to get something off of their chest, they know that you are a safe space in which they can confide and that it is supportive and it's non-judgmental. And that the rest is going to work itself out. So we'll go to our next question. In some cultures or families, talking about sex or HIV is still very taboo. How can someone start those conversations respectfully without creating conflict? Yeah, this is a really good question. So I would say time and place, of course, is very important. Probably a family dinner is not going to work. But I would try to start a conversation about health in general. Okay. What does health look like to you? What does it take to be healthy? Is that the gym? Is that a certain diet? Is that also making sure you take care of your mental health? And then you would need to pivot that conversation gently into the realm of sexual health. So it's like, if we're concerned holistically and completely with being healthy, whole people who have the best quality of life, we also have to have serious conversations around sexual health. And that can be a really complicated thing, particularly, as in your question says, in certain cultures. I know that in Latin America, a lot of times it's just not talked about that way. And so what I would suggest is opening one of those conversations that is about the entirety of what is health, get people to interact with that concept and then say, well, have you ever thought about this? And this is a part of that too. And I think that it's really important, but also you can role model that. I don't know if you are, in your friend group, or if, like brothers will laugh about like girlfriends they have, and sisters and girlfriends will laugh about boyfriends they have. So role model out as well, sexual, healthy lifestyles in terms of like bringing up conversations around PrEP and condoms and PrEP Plan B and PrEP and things like that. So these are some of the great ways I think to do that. I live in a small town where everyone seems to know each other. I feel that. How can someone protect their privacy when seeking HIV testing or prevention services in a place like that? Yeah, so that is really that's a heavy one. I guess I have a counter question for your question, is whether or not there is a dedicated facility inside of your town that provides HIV testing and prevention services. If there is not, or if there is, because of how small your town is, either way, it comes with complications. My recommendation to you would honestly be to go to a closer town that might have that, or a town where you're not known if you're really concerned about that privacy. But I want you to also know, like, you don't even have to do that. Doctors and nurses, yes, stigma and bias can still exist inside of the medically educated class, but they've had conversations about this, and I'm almost certain you won't have been the first person to ask for a testing before. In terms of privacy, I would definitely talk about that with your provider. I would have a frank conversation before actually soliciting the services. I would say, these are some of my concerns. I'm becoming more aware from reading or from social media or from ads, whatever it may be. And, I'm a healthy adult and I just want to take steps to protect my health and my wellness. And I would like to talk about HIV testing and prevention, but I would definitely preface that conversation with your expectation of privacy. And I know that we shouldn't have to, with laws like HIPAA and the concept of, doctor-patient privilege, confidentiality. But if it's something that is bothering you and that you're greatly concerned about, I would definitely have that conversation and maybe try to find an appointment time where, people are in work more, not like lunch break or something like that. But, ultimately we want our privacy, and we also want to make sure that we are taking steps to protect ourselves and take care of ourselves. So tough pickle there. Our next question says, I've noticed younger people sometimes talk about HIV differently than older generations who lived through earlier parts of the epidemic. How have those perspectives shifted? Yeah. So both the blessing and the curse of youth is that it can often lack some perspective. And that is okay. That's natural. We learn in life, we collect more experiences, because what is life other than a collection of experiences that we have? The reality is that, for example, I grew up during the time of microwaves and computers and video games. So it's very easy to take those things for granted. I always say that I'm impatient because I'm part of the instant gratification generation. We had fast food, microwaves, everything quick, quick, quick. And so I think that with this generation, these younger generations, they have not gotten to confront the realities prior to the benefits of modern medical science and clinical interventions and clinical maintenance. And so I think that while there's still an understanding that, conversations around sexual health and wellness and HIV prevention are serious, there's serious conversations in order to protect ourselves. I do think that it's kind of, for lack of a better phrase, taken a little bit with a grain of salt. It's like, oh, this or that, where older generations had to wrestle with the reality of losing friends and seeing the government fumble in its response, and seeing the medical complex not have the infrastructure, the power, all the funding and support at the right time that was needed, and a slew of other things to be able to adequately address it. And when you are older, you get to see the development of things. And so there comes a little bit of appreciation for, the process, what it took to get here. And so I think those perspectives have shifted because of a certain degree of privilege, to be quite frank. And part of the human condition is we tend to take things a little for granted. And so I believe that is definitely a part of it. Yeah. All right. Our next question says, I'm curious about how HIV affects different communities. Why do some groups still face higher risks or barrier than others? So this is classic with any issue, and it's not even specific to just HIV. The reality is that the powers that be choose which communities they want to care about. And that can even change from time to time. When we're talking about things, whether that be poverty, HIV, lack of mental health services, whatever, we're not talking about a byproduct that is accidental. We're talking about something that is systemic and intentional. And that is what we see with HIV affecting different communities in terms of higher risk and barriers of access. We know this to be true in BIPOC communities, and we know this to be true in areas that already struggle with a health services infrastructure. Quite frankly, is the reason why these limitations and challenges exist is systemic. It is how we're deciding how much funding to put towards this division of care. It's deciding who and where gets that money. It's deciding to support other services instead. But even the fact that we have not spent enough money, and the government has not spent enough money to actually do mass education around the realities of HIV care, prevention, things like that, it tells us where that priority lays. And quite frankly, in communities that are more marginalized, there's often greater struggle. There's often greater disconnect from the resources because a doctor's appointment is expensive, and yes, you can find prorated or even free clinics and services sometimes, but that's not available all the time for everyone. And so, there are issues in terms of even conversations we have. I do think that in certain communities, like I'm Black and Latina, we didn't really grow up talking about that. And when we did, it was never spoken about in a mature, informed way. It was spoken about as like this grim reaper hanging around the corner. And so even this actually creates higher risk. The reality is it also creates a barrier, because it creates a barrier that is self-generated. Our biases or our lack of information, the stigma that we internalize around a topic, will stop us from pursuing the care that we need, or even just being knowledgeable about it. I often find myself shocked by conversations that I have in personal and professional life with individuals who are from marginalized communities, and they're not even aware of like the basics, like U equals U, undetectable equals untransmittable. And so this shows a really profound gap in how we're reaching people and why we're failing them at the governmental and systemic level. So I see our next question. I've noticed HIV storylines showing up in some TV shows and movies lately. Do those portrayals actually help reduce stigma, or can they sometimes reinforce misconception? Wow. So generally, I find myself to be an advocate for visibility of people of different experiences, different backgrounds, different, I think that visibility creates conversation and it creates awareness, and that can be a wonderful thing. But as Spider-Man's Uncle Ben said, with great power comes great responsibility, and increased visibility is a form of power, but oftentimes that power is not sufficiently checked. I think that storytellers end up doing a disservice sometimes, because they have, particularly when they're treating with serious or delicate or under, spoken about themes, they have a moral onus, a responsibility, I believe, to try to shed light on that theme from different angles. And so I have found that a lot of times in shows, they have these very static caricatures or portrayals of people, living with HIV. They try to make it like a sex worker or somebody who uses drugs intravenously. They reinforce these kind of stereotypes that says this is an issue or a health concern related solely to one type of area, or it will be like, obviously the standard trope is people from the LGBTQ community. And so I think that those portrayals often fail their moral mandate to be humanizing and to make the topic relatable from every angle. I would be very interested in seeing one of those shows where it's like a suburban mom and her husband, had a breakup for a little while. They took a break and she got out there and got her, Stella got her groove back, or maybe, I would just be interested in seeing them pick a portrayal that would really shake up people's idea. I think it's important for us to really know that it's a public health issue collectively that we have to serve and take care of. Let's see. Our next question. We have one more question here. Well, we have two more questions. So how can I tell the difference between normal anxiety about sex and health and a gut feeling that something in a relationship isn't safe for me? Woo. I think that anxiety, the best way I can explain it is anxiety is like here. Your intuition is you can't see because I'm on camera, but your intuition is stomach and head. I don't care if it's, anxiety, because that's indicative of something, or if it's generally like an intuitive moment, a gut feeling, as your question said. If there is something telling you to hold on, okay? Because if there's nothing there to see, if there's no red flags, everything's okay, it's going to be okay once you reassure yourself of that. If it can't be okay while you take the time to get to the bottom of things, it's not meant for you. The reality is I encourage you to heed yourself. Very few people in this world will listen to you in the same way and with the same capacity that you have the ability to listen to yourself. listen to yourself, do yourself that service, do yourself that kindness, give yourself that trust and that confidence, and let you know, sort through what it is you are feeling. I also teach a communication model called CRAP, and it means communication resolves all problems. So if you are feeling like there is a point of anxiety or you know, a gut feeling there, you are completely within your right, inside of your prerogative, to spark a conversation with that person and try to get the information that you need to be able to assess it better. But my first, you know, piece of advice is always heed yourself, listen to yourself, listen to that sense. And even if it's just, you think it's anxiety, ask yourself what that anxiety might be stemming from. And that will be the part where you have the conversation. And so, yeah, if something is not safe, heed that. Our next question that we've got is, if I'm dating again after a long time, how early should conversations about testing or prevention happen? Well, this one is tough because everybody is an individual. You know, I would say that I have three basic you know, like recommendations or guidelines for you around that. It would be one, how quickly are you ask yourself, how quickly are you trying to move this thing along? Okay. I think it's important to have an understanding of what you're looking for in terms of the sexual component, the interaction of that dating part. I think also it's really important for you to decide, how does this person feel to me? I would test them out with some other information. You know, does this person feel safe to me? And then thirdly, I think that it's up to you. Listen to yourself, because this has been a tough conversation that I've had multiple times with people. And I've heard people say different things, like, you know, you should tell them right at the very beginning. You should tell them after a couple of dates. You should tell them only at the point of having sex. Everybody feels very differently about that. The only thing I would caution you is in some places in the United States, we still are very backwards, and our legislation reflects that, with laws that unfortunately criminalize a lack of disclosure. So I would tell you to definitely, if you live in a jurisdiction where that is the case, then I would definitely keep that in mind and hold on to that to protect yourself, you know? And then in those jurisdictions that do not criminalize, you know, not disclosing for those who are on treatment and who are undetectable, then you have a little bit more leniency there. I do think that this comes down to each individual. I have heard people say that, like, if I'm undetectable, then I don't need to disclose at all. And, you know, people will feel very differently about that. I think that we all want to be known genuinely. If we're dating because we're hoping to find something, you know, that goes the distance. And I would not personally want somebody to only know a fragment of me. You know, the whole point of me wanting a life partner is to find somebody that knows me more completely than anybody else, right? And accepts me for who I am, because there's no perfect relationship. Ultimately, you just got to decide, whose baggage am I living with? You know, whether do they know how to do dishes? That's what I want to know. But yeah, so you have to ask that yourself, you know. Much love to you. That's a tough one. And it looks like we are out of questions. Oh my God, I had so much fun. The time just flew by. Where did it all go? Well, we are coming to the end of our show, but I want to give you a few pieces of information. We will be back again the second Wednesday of next month, April, 1 o'clock Eastern Standard Time. We're going to be going ahead and plugging this afternoon some of those links up on our stories. And I encourage you to please go to aidsunited.org. Ask us your questions. Send us your feedback too. We love some good constructive feedback. Let us know what you would like to see and hear. This is a conversation, but the conversation can only be had if you'll chit chat. Also, don't forget that you can send any confidential, any sensitive, any anonymous questions to cperez@aidsunited.org. Look at that. I got that up there. That looks so cool. But yeah, we want to see you. We love you. And we will see you soon. You have a great day.